Morales. My classmate is Alfida Fernández. Today, we are going to be presenting our topic nutrition through pregnancy and lactation, and we are pretty excited about it. Introduction. Proper nutrition is crucial for both the mother and the baby during pregnancy and lactation. During these stages, a woman's body goes through many changes and requires more energy and nutrients to support the baby's growth, development, and later on milk production. In today's presentation, we're going to talk about the key nutrients needed during pregnancy and breastfeeding, some common challenges women may face, and also practical tips to help ensure both mom and baby stay healthy throughout this journey. Let's get started.
Hello everyone, it's Alfida speaking. Today I'll be discussing the essential dietary requirements during pregnancy and lactation, as well as the role of supplementation in maternal and fetal health. Let's begin with dietary intake during pregnancy. During pregnancy, a woman's caloric needs increases, especially during the second and third trimesters. Women with a normal pre-pregnancy BMI should consume an additional 340 calories per day in the second trimester and 452 calories per day in the third trimester. For women with a pre-pregnancy BMI of 25 or higher, the calorie recommendation should be personalized to ensure a healthy weight gain. Now, let's talk about macronutrients. Protein. Protein is crucial for fetal growth and maternal tissue expansion. So, pregnant women should aim for at least 71 grams per day. Carbohydrates are also essential with a recommended intake of 175 grams daily, including 25 to 36 grams of fiber to help with constipation. And help with digestion and prevent constipation is something very common that happens during pregnancy. So we want to help with that. Fat should make up 20 to 35% of the daily intake, caloric intake, with emphasis on food that contains omega-3 fatty acids to support fetal brain development. Now let's discuss this table of key vitamins and minerals that are essential for pregnancy. Let's begin with folic acid. Folic acid is crucial for neural tube development. All pregnant women should take zero point 0.4 to zero point 0.8 milligrams daily. But those that are at higher risk of neural tube defect, such as those with a history of spina bifida or otherwise, should take 4 milligrams daily. A deficiency in folic acid can lead to severe birth defects like anencephaly, meningomyelocele, spina bifida, and others. Vitamin B12. For vitamin B12, pregnant women who follow a vegan diet are at risk of a deficiency here, which can cause maternal and fetal anemia. The recommended daily intake is 2.6 micrograms. Iron. Iron is crucial for erythropoiesis, red blood cell production. Pregnant women need 27 to 30 milligrams daily to prevent maternal anemia, and failure to do so can lead to low birth weight, preterm labor, and fetal death. Calcium. Calcium. Pregnant women with low calcium intake should consume 1500 to 2000 milligrams daily to reduce the risk of preeclampsia and support fetal bone development and lactation, which we will be discussing further on in this presentation. Let's move on to iodine. Iodine is essential for thyroid hormone production. A deficiency can result in maternal and fetal hypothyroidism and impair neurocognitive development in the baby. The recommended intake of iodine is 150 micrograms daily.
Dietary restrictions during pregnancy. When it comes to food and drinks during pregnancy, there are some important things to keep in mind to keep both mom and baby safe. First, caffeine should be limited to less than 200 milligrams per day. That's about 2 cups of coffee or 4 cups of caffeinated tea. Too much caffeine can affect the baby's development and sleep patterns. Alcohol. Alcohol should be completely avoided throughout pregnancy since it can have serious effects on the baby's growth and health. Seafood is a great source of nutrients, but some types contain high levels of methyl mercury, which can be very harmful to the baby's nervous system. It is best to avoid fish like tilefish, swordfish, shark, king mackerel, and big-eyed tuna. It's also important to be mindful of foodborne illnesses. Foods like raw or undercooked seafood can carry parasites and norovirus. Raw eggs can be contaminated with salmonella, and unwashed fruits and vegetables may contain harmful bacteria like listeria or parasites like toxoplasma. By making smart food choices, moms can help protect their baby's health and ensure a safe and healthy pregnancy.
Once a baby is born, a mother's dietary needs continue to be crucial, especially during lactation. Breastfeeding mothers need an additional 330 to 400 calories per day to maintain energy levels and sustain milk production. Since breast milk is mostly water, it's important to stay well hydrated by drinking 8 to 10 glasses of water daily. Protein remains an essential nutrient during lactation, with daily recommendation of at least 71 grams. This can be sourced from lean meats, eggs, dairy, beans, and nuts. Fats, particularly omega 3 fatty acids, are important because they support the baby's brain development. It's going to be the same recommendations as before. Micronutrients like calcium intake should be at least one 1000 milligrams per day, which can be obtained from dairy products, leafy greens, fortified foods, or supplements. Iron is still necessary to prevent postpartum fatigue and anemia. Lastly, vitamin D is crucial for bone health and it can be obtained through sunlight exposure, fortified foods, or supplements.
Okay, so now we're gonna go with the dietary restrictions while lactating. When it comes to breastfeeding, there are certain substances that can affect the baby's health, so it is very important to be mindful of what a mother consumes. First, we have alcohol. There is no safe amount of alcohol in breast milk. If a mother drinks, she should wait until the alcohol has completely cleared from her system before breastfeeding. Caffeine is another one to watch out for. Too much caffeine can make the baby fussy or even disrupt their sleep. And then there's fish. While fish is a great source of nutrients, some types contain mercury, which can be harmful to a baby's developing nervous system if it is consumed in excess through breast milk. So, being aware of these factors can help ensure the baby's health and well being during breastfeeding.
Now let's apply this knowledge to a clinical case. A 36-year-old preemie-gravid woman at 15 weeks gestation comes to the physician for a routine prenatal visit. She has not been taking prenatal vitamins and admits to consuming alcohol regularly. Pelvic examination shows a uterus consistent in size with a 15-week gestation. A quadruple screening test shows markedly elevated maternal serum alpha fetoprotein, maternal serum concentration of beta human chorionic gonadotropin, estriol, and inhibin A are normal. Which of the following is the most likely explanation of this finding? So I'm gonna let you pause this recording and trying to get to the answer. I will continue to saying which one's the correct answer now. So the correct answer is spina bifida cystica. Elevated alpha fetoprotein is a hallmark sign of neural tube defects, such as spina bifida cystica. This is likely due to folic acid deficiency, reinforcing the importance of prenatal vitamin supplementation. I would like to also highlight the fetal alcohol syndrome. While this condition can result from alcohol consumption, which the mother admits to doing, it does not cause elevated of alpha fetoprotein, making it an unlikely choice. But it is a disorder caused by perinatal alcohol exposure, and it can lead to significant damages to the child, like neurodevelopmental damages, facial, and growth abnormalities. This case highlights the importance of prenatal screening and proper folic acid supplementation to prevent neurotooth defects like spina bifida.
Eating a well balanced diet during pregnancy and breastfeeding is one of the best things a mother can do for her baby. Good nutrition helps support healthy growth and development, giving the baby a strong foundation for life. When a mother takes care of her own nutrition, she's also taking care of her little one, providing the nourishment, love, and care the baby needs to thrive. And remember, even small healthy choices every day can make a big difference in both the mother's and baby's well being. These are the references and resources that we use to make the presentation. And thank you for your attention.